let's you can continue eating, but let's continue the program. So I'm going to introduce Kim Alexander, who's going to introduce the next speaker, and we're going to have a discussion today about the support systems for the from the Leukemia Lymphoma Society. Everybody quiet? And you're saying this microphone's not on? It's on. It's a little. Can you hear me now? All right. It'll help if everybody quiets down. Okay. So we're going to have a discussion now from the Leukemia Lymphoma Society, and I'm going to introduce Kim Alexander, and she will introduce the speaker. Kim.
Good morning. It's still morning here. I am so happy to be back here. I was here last year. I'm a friend of Pat's. I'm so honored to be allowed to be a part of this event again. I don't know how many of you all know my backstory and my connection with myeloma. Okay. And I thought that you'd hear me because I'm closer to the mic. You have to lean over. Is that better? No? Okay, let me just kind of lean in while I speak. So my backstory with myeloma started back in 2005 when my husband, Elijah Alexander, was diagnosed with myeloma at the age of 35. Elijah was an NFL linebacker, and he was diagnosed a couple of years after he retired from football. And we were completely caught off guard, completely blown away, because here he was, you know, this strapping athlete, 6'3", 235 pounds. And by the time his myeloma was caught, he was stage 3B, going into organ failure. Now, what I will say is, despite the fact that our myeloma story did not end the way we had hoped it would, this month actually marks the 7th year that Eli has been gone. He passed away in March of 2010. What I can say is that I am over the moon about all the advancements that have been made since then. And one of the things that I've been most appreciative of is all of the hard work between the pharmaceutical companies, even all of the nonprofits that are raising awareness and doing so much for myeloma patients. And hopefully that work will continue to happen. And one of the things that I do locally in Dallas is I'm a part of the Leukemia Lymphoma Society there. I do a lot of fundraising there and help with just raising awareness and the profile of myeloma amongst people who aren't aware of it. And I'm happy to hear that the LLS is here this year to be a part of this event and talk to you all about the resources that they have available for myeloma patients. So I would like to introduce to you Seth Berkowitz. Come on over. And I'll allow him to introduce himself to you all and tell you what he does for the LLS and myeloma patients. Thank you, Seth.
Hi, everybody. Thank you for having me. Can everyone hear me okay in the back? I have a pretty loud voice, so usually microphones are not an issue for me. My name is Seth Berkowitz, and I am the Senior Patient Access Manager for the Leukemia Lymphoma Society, and I'll be celebrating my 11th year with LLS this month. And I'd like to also recognize Sharon Cohan sitting here in the front row. And Sharon is the Patient Access Manager for Florida and my partner in crime. And the two of us cover from Tallahassee across here to Jacksonville and all the way down to Key West. So we cover everything kind of east of the Panhandle in Florida. And we work with all the cancer centers across the state. Our job is really patient and professional engagement. So speaking to people like all of you, I heard some people have support groups in communities. They want us to come out and speak. We're happy to do that. We want to come out. We want to talk to you. We're building a new volunteer structure, and we will definitely talk to you about that as well. So I'm a licensed clinical social worker in the state of Florida. I'm also a certified child life specialist, and for those of you who don't know what that is, but I've experienced working with children with cancer, and I've been doing that for over 25 years. So just so you know our mission, and I've heard already several times, I am not the high man on the totem pole, I'm the low man. Changing the name of LLS is not something I have the ability to do, okay? So myeloma is not in our name, but it is in our mission, okay? So very clearly, we are trying to cure leukemia, lymphoma, Hodgkin's disease, and myeloma, and improve the quality of life for patients and their families. But I can't. Okay? I can't. I can't. So it's in the mission. Okay, I'm the low man on the totem pole. Right to Dr. Liu, our CEO. Let him know. But I'm not the guy who can do that. So just so we get that out of the way. But we did have a great call with Dr. Liu just this week. So you guys are getting kind of hot off the presses information. So this is kind of a quote from our call. I paraphrased just a little bit. But Dr. Liu announced that we are doubling down on all of our myeloma efforts, both research and support for patients. We're reaching nationwide. Myeloma patients are one of the highest groups we're engaging. We're reaching almost 40% of new myeloma patients across the country. And that's a very high number compared to the other diseases that we work with. And so that's really important, and we're really trying to increase our efforts. He does not want to see just extended life anymore. He wants to see cures. We need cures for myeloma, and we need them now. We've seen a lot of new drugs that have extended people's lives, and we all benefit, all of our patients benefit by time and technology. But what we really want to see are cures, and he announced that on our call the other day. So you guys are the first to get this information at any large national conference. So I'm going to cover just a few things about LLS. I'm going to cover research. I am not a researcher, okay? So it's a very broad overview of research that LLS has been doing. I'm going to cover our educational resources, our support resources, our financial assistance program, and our advocacy and public policy initiatives. And my goal is to have a dialogue with you today, so I'm going to go through the slides fairly quickly and then really open things up for questions and answers. But stop me if you have a question. Stop me. And I will do that. So research. So one thing that you should know is that we have spent approximately $70 million in myeloma research since 2009, and we are going to be increasing that investment on an annual basis moving forward. So the annual investment in myeloma research is increasing. And this is a slide our national public relations staff sent me. And so this shows where LLS has helped fund different drugs that are treated in myeloma up until today. And then it also shows what our future research is funding. So we're funding BET inhibitors, vaccines, more HDAC inhibitors, checkpoint inhibitors, and CAR T therapies, all for the use in the treatment of myeloma. So we're really looking at all those things in a very way. Again, here's a list of some of the current research projects in myeloma that we are doing right now. And then, the future is that, we know that we need to change that myeloma is an incurable disease. We want to say myeloma is a curable disease. But we're focusing on underlying the drivers of myeloma, more targeted therapies, and then we want to look at how do we stop MGUS from becoming multiple myeloma. We know that that's an important factor as well. We want to also look at why do people stop responding to therapies that are working and figure out how we prevent that from happening. So if you have a therapy that's working, we want it to keep working for you and not that you fail multiple therapies along the way. So, and then also as an emerging science, of course, immunotherapy is huge in all of the blood cancers, and we're working on CAR T in all these initiatives. So support. So it's Myeloma Awareness Month. Happy Myeloma Awareness Month, everybody. LLS is really recognizing that in a big way this year. If you look on our website, there's a whole landing page on Myeloma Awareness Month. So one of the facts that's up there is that we have spent $180 million in support for patients, support and services for patients specifically with myeloma. This is not for everybody. This is specifically for myeloma patients. $180 million. And we do that through a variety of things. So this is our blood cancer conference, and I just featured two of the speakers that we had there. Up in the top middle, you'll see Dr. Rashid Baz from Moffitt, who is one of the myeloma experts there, who came to Fort Lauderdale to speak at our conference this year. And the other one is Krishna Kalmanduri, who is the director of stem cell transplant at the University of Miami, and he is also now, at the time he was the incoming president of the American Society of Bone Marrow Transplant Programs. And he talked about novel cellular therapies. So we have these large conferences. There are 10 of them across the country. Florida is lucky enough to have one. We will be having another one next winter. I encourage you to come and participate in it. It's a great day of learning from 10 to 3. We try to make it someplace that's accessible. I know many of you are from around the country, but I know a lot of you are from the Jacksonville area. Did you know you could fly to Fort Lauderdale for the day for $60 each way on JetBlue? So it's one of the reasons we picked Fort Lauderdale and being right near the airport as our location. We also know that people from Tampa can do the same thing. So we tried to make some logic into how we picked where we could be. It's much harder to fly to Orlando, even though it's much more central. It's much harder to fly to Tampa from different parts of the state. So we did it, and then also there are a lot of people in South Florida. And I'd like to announce we exceeded our target for the first year. So our target was to have 250 patients, caregivers, and healthcare professionals. We had 280, and we had to close registration down. And between our speakers, volunteers, staff who were there, and exhibitors, we had 350 people at the conference. So, and that was our first year to really have statewide Florida conference. Disease booklets. So on your table, I put out our 3 myeloma specific disease booklets. So you can have them, but they're all on our exhibit table out front. Take them home, take home multiple copies of them and give them to your friends and family who have multiple myeloma or want to learn more about the disease. They're a great resource to have. One thing about our booklets is that they're updated on a very regular basis. So if you go and you order booklets from the National Cancer Institute, because Sharon and I see this a lot, when we go to the cancer centers, they'll have out those National Cancer Institute booklets, and we'll look at their myeloma booklet, and it's from like 2008. Well, how much has changed in multiple myeloma since 2008? A ton. If you look at ours, they're 2013, they're 2014, they're 2016. They're very current. It's usually about every 2 years that they start the revision process. And you'll also notice, because we ordered a lot of the books updated and fresh, they have an insert sheet with an update on it, because if we have an update, we don't wait to the time to revise the book. We immediately insert an update sheet into our booklets and materials. We have videos on our website. Our website is a great resource. You can order the books from our website. This is a video that we did on oral therapies and myeloma medication adherence with Ken Shane from Moffitt. So there's an opportunity here. We had doctors, patients, nurse practitioners, nurses all together putting this video together. It's on our website.
Seth, I have heard one comment this weekend that our website is hard to navigate. Is there a trick that you could show to get to the myeloma information?
So there's not a trick because this isn't live, but if you look at the yellow box up there where it says patients and caregivers, if you click down on that, it all drops down and shows you everything for patients and caregivers, and you'll see myeloma that you can click on right there. But also each of these areas you'll see there's a place for videos, and I'll show it the same thing with each one. I pulled a lot of these from the website so you can see that. So it's different than we had before, but I don't think it's so difficult to navigate if you know to click on that yellow patient and caregiver box. And everything's listed down there. The blood cancer conferences have their own landing page, as well as the disease-specific ones. So we also have online chats, and they're listed there on the page, but you'll see there's one for caregivers, one for multiple myeloma, and we talked about a 35-year-old with a blood cancer. We have a 30-year-old with multiple myeloma in our area, and she's very involved in our young adult group, but we also have a young adult chat. So if you're not someplace you can easily access a support group, these are online chats. And one of the things we're really proud about all of our support groups and our online chats is that they're all professionally facilitated. They all have a nurse, a social worker, a psychologist, someone who runs those groups, so that they're not just peer-led groups, which are good, but we take it to that next level and really feel that having that professional there to help guide the information is really important as well. We have a peer mentoring program called the Patty Robinson Kaufman First Connection Program. And that program is designed to provide guidance to you, and that's where you get that peer-to-peer support. To have another survivor who's been through what you're going to go through to listen to you. So whether it's a newly diagnosed patient and they want to talk to someone, or whether it is someone who's going to go for transplant and they want to talk to someone who's post-transplant. Maybe they want to talk to a survivor who's never had to go for transplant, or someone who's had MGUS for a long time and never had to go for treatment. We have all of those resources in our First Connection program, and you can talk with a volunteer who has been through that. So this is one of our specially trained volunteers, and Sharon runs that program for us in Florida and works with all of our volunteers. I will tell you, please refer patients to us. We have about 5,000 First Connection volunteers in our database, and right now, nationwide, and right now we get about 1,000 to 1,500 referrals every year. for first connection matches. So we have a lot of volunteers who aren't being used. So we're in the process of cleaning out the database a little bit, getting rid of volunteers who don't want to remain active, working on a marketing plan to increase our first connection matches. You can help by referring people to it. But also know because of that, we're not training any new volunteers. So if you're going like, ooh, that's something I'd like to do, I'll kind of give you the path to that when we get to how you can help at the end. We aren't training any new First Connection volunteers in this moment, but we hope to be sometime next year. We have a new resource called LLS Communities, and so yeah, it kind of shows right there. If you click on community, it goes to that. And what it is it's Facebook for blood cancers. Really specific, really focused, much more safe and protected. Again, it's professionally moderated by our national staff. But what it is right now we have 400, and I took these last night, so 4,321 community users. There have been 9,890 comments. So one of the neat things about this, though, to keep patients engaged, is that there's a daily question of the day. And right now, we're just gathering that information. We're not using it for research or anything, but the goal in the future is to turn this into a cancer registry and be able to use the information we're gathering to actually have people opt into research-based questions that we can ask or look at within LLS communities. So those questions are there. And then, of course, we have average age, average diagnosis, more women than men participating, and you'll see this. 2,901 diagnosed patients. There's 831 caregivers, and there are 845 supporters, which also includes all of our healthcare professionals who are partners. So you can go join this, and it's a great opportunity. We're taking it to the church. So we know that multiple myeloma affects the Black community more than it does the white community, at almost twice the rate. But if we look around this room, we can see we don't see twice the number of Black multiple myeloma patients and caregivers here learning along with you guys. So we know we have to get the So we have a grant to pilot 2 programs, one in DC and one in Atlanta, where we're going to actually have myeloma ambassadors speaking in the pulpits in primarily Black churches through the National Black Church Initiative to increase awareness about multiple myeloma in the Black community. This is a brand new pilot. It's launching this month. They're going to have their first presentations at Black churches during March, during Myeloma Awareness Month. So clinical trials. In multiple myeloma, we know that you are probably going to, at some point, fail the treatment that you were on and need something new. Well, what we want you to think of is on day 1 of diagnosis, about new things with precision medicine, about the idea that clinical trials are maybe, for many patients, the best option for treatment. You get additional monitoring for free. With a lot of them, you get additional testing for free with a lot of them. And you're getting a lot of access to some of the newest drugs that have improved outcomes. Or you may just be, some of the studies are not about improved outcomes, but just monitoring side effects or improving quality of life. So it depends on your interest and what you decide. So we have 2 clinical trials specialists that specifically work with patients to identify and talk to their doctor about enrolling in a clinical trial. So we get about 60,000 calls a year to our information specialists. They're open Monday through Friday from 9 a.m. to 9 p.m. They screen everybody for a clinical trials option and talk to people. If they do that, you then get referred to our clinical trials service. They evaluate your need. They educate you. Okay? They help make sure about your physical status. If you go to the National Cancer Institute and you search for myeloma clinical trials, there's probably 30,000 of them listed. 420. I think that's all.
No, that was on the previous presentation.
So what we want you to do is we want to be able to narrow down that search for you. We want to give you a list you can talk to with your doctor. We want you to know that our clinical trial specialists will get on the phone with your doctor as well and talk to them about why a clinical trial might be the best option for you and which one, and help you communicate. And then if you and your doctor decide you should be on a clinical trial, one recommended to you by LLS and our clinical trial specialist, they will enroll you in a clinical, to help you enroll in that clinical trial and get everything done that you need. So nationally, how many people do you think adult patients enroll in clinical trials? 5%. Okay? I think it's actually a little lower than that. We have one of the most successful clinical trials referral programs. Almost 50% of the people who, over 50%, sorry, of the people who work with our clinical trial service, 58% wind up being enrolled in a clinical trial. And those are the numbers we need to find cures.
Question. Maybe this is simplistic, but how do you know to get into a clinical trial? I mean, mine's in remission, but are there clinical trials for people who don't have, I mean, is it only for people who are showing higher symptoms? I mean, where's the balance?
So, I mean, I think anyone who's going to either need to start or do a new treatment protocol definitely is someone who is eligible to look at clinical trials and should be looking at clinical trials, especially with precision medicine. But I think if you're someone who's in remission, you've been out of treatment a while, there are some maintenance trials out there that might wind up being helpful to you, even if you just know about them, even if they're not right for you at this moment. There are side effect trials that they look at. So if you had treatment before, but you're not doing that. And so our information specialists will work with you to figure out if it's right for you or not. But you can always call them and ask the question. And there are, I think there are more and more quality of life trials for people who are not really doing any treatment, but they want to monitor them more closely during that time to figure out, maybe even looking at why that person isn't. What are the genetic markers of your particular multiple myeloma that are keeping you in remission longer? So there are all sorts of new trials out there that might be good for you to participate in, even if it means you doing nothing but giving some extra blood at the doctor's office. And so talking to the information specialist and seeing what's available is always a good thing. So that's our clinical trials program. So financial assistance for blood cancer patients in need. So we have two financial assistance programs. One is our copay, and one is our Susan Lang Pay for Travel Assistance program. Both of these programs are based on being within 500% of the U.S. poverty level. We do not look at assets. We just look at income. So that's really important. So a family of four can make $125,000 a year and still qualify for this program. It will also take into account if you've stopped working because of your disease, and last year your income showed higher, but you know it's not going to this year, it will take that into consideration and look at that. Our myeloma fund is currently offering $10,000 a year of assistance to myeloma patients. That's enough to enroll in an Affordable Care Act Platinum plan and have all of the premiums covered by our copay program. So if you don't have insurance and you have multiple myeloma, there's really no excuse. You can sign up with us, you can get insurance, you can get the premiums paid for. Because that's what we cover. We cover premiums and we cover treatment reimbursement. So we don't cover scans, we don't cover doctor's office visits. There are other programs that do that. Our Susan Lang Pay Forward program, travel assistance program, is closed right now, and our office is working, our national office is working, getting more money for it. But what that gives is a $500 debit card that's restricted to be used for travel expenses, hotel, airfare, gasoline, that you can spend once you're approved again in the calendar year. And it does open and close. Sharon and I recommend that like once or twice a month, you just pop onto the website and look and see if it's open. It just closed, so it's probably not going to open this month, but that doesn't mean it won't open again in June or July 1st when we have our new fiscal year, when some of the grants that fund that program get renewed. And of course, if you work for a company or a large business that you think would like to give us a grant, help keep this program open, we would love to talk to them. Sharon and I will be happy to talk to them and work with our national office to talk to them. We're already working with our executive directors in Florida to find local sponsors who would want to say from Florida or southeastern United States copay assistance. But just so you know, we're looking for people who are willing to commit to a minimum of $250,000 a year for that. So in California is open because they have a local company that funds Southern California travel assistance. Theirs has never closed. So if you're from California, that's good to know. But we want to get that in the southeastern United States or in Florida as well. It'll be open again in May. Okay. You know more than I do then. That's good.
That's what they told me.
So, but I want to talk about dollars because I think dollars are important to know too. Our unique copay assistance program has distributed $130 million to almost 30,000 multiple myeloma patients since 2007. And then I just got from our finance department just closed out the 2016 calendar year for us, and I got this number yesterday. So in calendar year 2016, $21 million was distributed through our myeloma copay silo to myeloma patients in calendar year 2016 alone. So that is a lot of money. There's a lot of money out there, and that is one of our copay silos that is never closed. So I encourage you, if you've not reached out to our information specialist or our copay department or our website, you can apply right online. Go and do that and apply for travel assistance copay assistance if you qualify. So we're here to help. Where do you find us? I think that's really important. So on the back of all the books on your tables, it lists our numbers, but we're two places. One, you can speak to an information specialist. So this is how we want you to get in touch with us. We want you to first call an information specialist because Sharon and I are here, right? We've spent this entire week driving around the state of Florida since Monday morning. We have not been on our phones to answer and talk to a patient who called us. But our information specialists have been. They're there Monday through Friday, 9 a.m. to 9 p.m. And they've called us 5 times when we were on the road this week, asking a question a patient in Florida had, giving them the answer, and them calling the patient back. So the patient got a response even though we were on the road and weren't able to call someone back. So they do that all the time. But we are, and you can reach them by phone. On our website, they have live chat, and there's also an email form you can complete online. But we also have local chapters. You can find your local chapter. You can call your local chapter. We have volunteers in all of our local chapters across the country who are talking to patients, connecting them to the IRC, telling them about local support groups, local educational programs, whatever is going on locally in their community. We have that as well. And you can also occasionally speak to someone like Sharon or I, although mostly we're out in the field. In Florida, when you call one of our Florida chapters, typically what you get is one of our interns. And we have a senior social work intern who sits in the office and answers the phone for us as well. So you will get someone, and they do answer a lot of questions, and they're very knowledgeable. We train them really well, and then they don't need the answers just like the IRC. They come to Sharon and I, they ask us a question while we're on the road, and they get back. Advocacy. So we have an Office of Public Policy. Our Office of Public Policy is there to make you aware when Congress or your state is doing something that's going to either be good or bad for cancer patients. And I say make you aware because it's really important to know that's all we do. We give you the tools and the option to act and call, but what we really want you to do is be well educated about public policy initiatives. We're working very hard this year, and we've been working since last year. We need oral drug assistance and parity on a federal level. We have it in most of the states. We have state laws, including here in Florida. We need it on a federal level. So that's really our thing. How do we bring oral drug costs down for cancer patients? We've done the studies. We know most patients who have to pay more than $100 a month to stay in their treatments aren't compliant with them. So we want to get those costs down. So how can you help? You can refer another patient. That's one of Sharon's and my goals. You hear someone was newly diagnosed with multiple myeloma, give them our 800 number, get on the phone with them with one of our information specialists, get them to call LLS. You can volunteer in your local chapter. And this is our website that leads you right to our volunteer application. You fill that out. We get an email every Friday with all the people who applied that week, and we now reach out to you to sign you up for an orientation. You can join us at Light the Night and help bring light into the darkness of cancer. We've expanded our Light the Night walks. Yes, they're our fundraising walks. All of our Light the Night walks across the country, we invite each and every one of you to come out as a patient and caregiver and walk alongside us, even if you've not raised a single dollar. You are our guest. The walk is all about you. We have a survivor circle now that's new. We have supporter enhancements. We have a great new format for the walk this year. If you've never walked with us, please come out and walk with us. Be a part of it. Help us raise awareness. Get a survivor t-shirt. Get a white lantern that indicates you're a survivor, and come be a part of our walks. Become an advocate. Again, the public policy, that's where you can go. And of course, if you have the capacity, certainly donate. We're doubling down on myeloma. We need to raise money to do that. We have some money that's coming in some ways of some things that we've done before, but we need new money. We need you to connect us to people who can donate. Please, give. So we have one goal. It's a world without blood cancer. With that, I'd like to open it up for discussion and take any questions. Go ahead.
The local chapter, LLS chapter in Portland, Oregon, used to sponsor our support group, and the funding was pulled. We pulled funding from LLS.
Even that posh, right?
How did we get that funding back?
So we had some
Another
changes
camera.
in our patient access department, actually, and in a lot of our departments, to make sure our organization can stay solvent. So there is funding for family support groups still. They've reduced it a little bit. There is still funding there. But to be considered an official LLS support group, again, it has to be registered with LLS, and to do that, it has to be professionally facilitated. If it's not professionally facilitated, certainly an LLS representative maybe able to come out once a year, will probably be a volunteer, and provide some snacks or something on the one day that they talk. But any kind of financial support has to come through our official family support group program and guidelines. And I will tell you, we just finished a year and a half evaluation of all of our support groups. We're going to begin expanding it again, probably this fall, and looking at how we can bring some more support groups to markets and areas that need them. And we're going to be trying to figure out how we make the process of doing those support groups more efficient for our facilitators and more efficient for being reimbursed for their expenses. And that is one of our goals and targets, and it is some of the feedback we got. And we did, like I said, a 1.5-year survey. We surveyed staff, we surveyed facilitators, we surveyed executive directors in our chapters, we surveyed participants, we did phone interviews with staff, with facilitators, with participants. So that's why it's taking so long, because each phase we have to develop surveys, we have to do all these things, but they are out there. There is still some funding, but again, it has to meet our guidelines of being an official support group. And the facilitator has to ask for it. And what was happening before was that we were paying for a lot of things directly. And one of the changes that took place was we now ask the facilitator to lay out the money, provide a receipt for what they spent to their staff person, and then that staff person does a check request and reimburses them. And so that, that wasn't a change, but there is still some funding. I don't know what other financial support you had or needed, but we can certainly talk about that with you individually when I'm done. Other questions? Just out of curiosity, is there anyone in the room who's used our copay program? So there are a few more of you out there probably qualified for that. So please make sure you use that. Sharon and I will be here. We have all the books and materials. If you run a support group locally or a distance and you want to take the booklets back with you, or again, if you click down on that yellow drop down, you can order all of our materials and we'll ship them to you free of charge. Or if you call an information specialist, we'll ship them to you free of charge as well for everything we do. Because everything we offer for patients and families is free.
The one thing we need to bring with us is our bone marrow transplant information booklet. I heard somebody looking for one of those. We do have those for free online, or you can contact one of us.
Any other questions?
Thank you. I am told our next speaker is on his way, so I think it's actually a good time. Let's reconvene, take a 15-minute break, go outside, move around. Remember this morning, move around, walk.